Today's case is quite an interesting case. I'm doing an overdenture. However, in this case, there's a lot of cortical bone. So it's very, very dense, hard bone. The inferior alveolar nerve is pretty much on the ridge. So I'll show you the X-ray later, and we are planning 3.75 by 8 mm Newton implants in the 2.2-2.3 area. So 3.2-3.3 and 4.2-4.3 area. So 2 implants. Obviously, we've got to over prep in this case. So I would use the plusters as well, so that there's not too much of heat produced and there's no fractures as well. So this is a quite an interesting case, hence the recording. There's a lot to learn from this case. All right, so this is the case I was talking about. We've got those 2 implants, 3.75 by 8. You can see how cortical the bone is. So we've got to make sure that we prep enough. I'll be burying the implants, so even if I don't get enough torque, I'm not too fast. Now you can also see there's this little buccal shelf there that will obviously need to be flattened, otherwise it becomes a problem with food getting caught in. Now, the most interesting bit, look at the foramen, where the foramen is, where the nerve is. It's right on the ridge. So I've got to make sure I stay away from this area. That's the other side. Again, it's right on the ridge. So just got to be very, very careful when we do this case. So I'll be making my incision lines. So the measurements, so from the midline, that's about 23 mm on each side. So I'll not go more than 16 mm or 20 mm, ideally 16 to 18 mm on both the sides with the incision line. And I'll keep the incision line a bit lingual as well, so we don't have issues.